Hello guys, welcome to my channel Twastramanas.
In this video we are going to see the other 6 types of counseling. 7. Mental health. 8. Child and adolescent counseling. 9. Grief counseling. 10. Trauma counseling. 11. School counseling and 12. Crisis counseling. Introduction. Mental health counseling is a vital aspect of providing support and assistance to individuals facing psychological challenges. It involves a structured process that aims to help clients understand their feelings, behaviors, and thoughts while empowering them to make positive changes in their lives. Throughout this guide, we'll explore the stages, models, and tools utilized in mental health counseling, along with practical examples to illustrate their application. Stages of counseling. 1. Establishing rapport. The initial stage of counseling focuses on building a trusting relationship between the counselor and the client. This sets the foundation for effective communication and collaboration throughout the counseling process. For instance, a counselor may engage in active listening and empathetic responses to create a safe space for the client to express themselves freely. Consider a scenario where a counselor, Sarah, meets with a new client, Alex, who is struggling with anxiety. Sarah begins the session by warmly greeting Alex, offering a comfortable space, and actively listening to his concerns. Through her empathetic responses and genuine interest, Sarah builds rapport, establishing trust and creating a supportive environment for Alex to open up about his experiences. 2. Assessment and goal setting. During this stage, the counselor conducts a comprehensive assessment to gather information about the client's background, presenting issues, and goals for counseling. This may involve using standardized assessment tools, conducting interviews, and exploring the client's strengths and resources. For example, a counselor working with a client experiencing depression may use the Beck Depression Inventory to assess the severity of symptoms and collaboratively set goals for treatment. 3. Exploration and insight. In this stage, the counselor and client work together to explore underlying thoughts, emotions, and patterns of behavior contributing to the client's difficulties. The counselor may utilize various therapeutic techniques such as cognitive restructuring, mindfulness exercises, or narrative therapy to facilitate insight and self-awareness. For instance, a counselor assisting a client with anxiety may use cognitive behavioral techniques to challenge irrational beliefs and teach relaxation strategies to manage symptoms. 4. Action planning and implementation. Once insights are gained, the focus shifts towards developing practical strategies and action plans to address the client's concerns. This may involve setting small, achievable goals, practicing new coping skills, and monitoring progress over time. For example, a counselor working with a client struggling with social anxiety may help them gradually confront feared situations through exposure therapy while providing support and encouragement. 5. Review and termination. The final stage of counseling involves reviewing progress, celebrating achievements, and preparing for termination or transition. The counselor and client reflect on the changes made, identify areas of continued growth, and discuss strategies for maintaining progress post-counseling. For instance, a counselor may help a client develop relapse prevention strategies and provide referrals to ongoing support services as needed. Models of counseling. 1. Psychodynamic therapy. This model emphasizes the role of unconscious conflicts and early life experiences in shaping current behavior and relationships. Through techniques such as free association, dream analysis, and interpretation, clients gain insight into underlying dynamics and patterns. For example, a psychodynamic therapist may help a client explore how childhood experiences influence their current relationship patterns and self-concept. 2. Cognitive behavioral therapy, CBT. CBT focuses on identifying and challenging maladaptive thoughts and behaviors that contribute to psychological distress. Clients learn practical skills to change negative thought patterns, modify behaviors, and develop more adaptive coping strategies. For instance, a CBT therapist may teach a client with panic disorder relaxation techniques and cognitive restructuring to reduce anxiety symptoms. 3. Humanistic existential therapy. This model emphasizes the importance of self-awareness, personal growth, and authenticity in living a fulfilling life. Therapists create a supportive and non-judgmental environment where clients can explore their values, beliefs, and existential concerns. For example, A humanistic existential therapist may help a client struggling with existential anxiety find meaning and purpose in their experiences through exploration of values and existential themes. Tools of counseling. 1. Genograms. A genogram is a visual representation of a client's family history, illustrating relationships, patterns, and dynamics across generations. It can help clients gain insight into intergenerational influences on their current functioning and relationships. For instance, a counselor may use a genogram to explore how family communication patterns contribute to a client's difficulty expressing emotions. 2. Socratic questioning. Socratic questioning involves asking thought-provoking questions to encourage critical thinking and self-reflection. It helps clients examine their assumptions, beliefs, and perspectives more deeply. For example, a counselor may use Socratic questioning to help a client explore the consequences of their actions and consider alternative viewpoints. 3. Behavioral experiments. Behavioral experiments involve testing out new behaviors or beliefs in real-life situations to gather evidence and challenge existing assumptions. They help clients overcome fear and avoidance by providing opportunities for experiential learning. For instance, a counselor may conduct a behavioral experiment with a client with social anxiety by encouraging them to engage in social interactions and observe their reactions and outcomes. Mental health counseling is a collaborative process that empowers individuals to overcome challenges, enhance self-awareness, and achieve personal growth. By integrating various stages, models, and tools of counseling, counselors can tailor their approach to meet the unique needs of each client. Through compassionate support, evidence-based interventions, and ongoing collaboration, mental health counselors play a crucial role in promoting well-being and resilience in individuals and communities. Child and Adolescent Counseling, a comprehensive guide. Child and adolescent counseling is a specialized field of therapy focused on assisting young individuals in managing and overcoming emotional, psychological, and behavioral difficulties. This form of counseling aims to provide children and adolescents with the tools and strategies they need to navigate various challenges, fostering their overall mental health and well-being. The process involves several stages, models, and tools tailored to the unique developmental needs of young clients. Stages of child and adolescent counseling. 1. Assessment and engagement. Initial assessment. The first stage involves gathering comprehensive information about the child's history, current functioning, and presenting problems. This includes interviews with the child, parents, and sometimes teachers. Building rapport. Establishing trust and rapport with the child is crucial. This involves creating a safe, non-judgmental environment where the child feels comfortable sharing their thoughts and feelings. 2. Goal setting. Collaborative goal setting. The counselor works with the child and their family to set specific, measurable, achievable, relevant, and time-bound, SMART goals. These goals guide the counseling process and provide a benchmark for progress. 3. Intervention and therapy. Implementation of interventions. Based on the assessment, the counselor selects appropriate interventions and therapeutic techniques tailored to the child's needs. Regular sessions. Therapy sessions are conducted regularly, during which various therapeutic activities and discussions take place. 4. Monitoring and evaluation. Ongoing assessment. The counselor continuously monitors the child's progress, adjusting interventions as necessary. Feedback. Regular feedback sessions with the child and their parents ensure that everyone is aligned and any concerns are promptly addressed. 5. Closure and follow-up. Termination. Once the counseling goals are achieved, the process of ending therapy is carefully managed to ensure the child is prepared to move forward independently. Follow-up. Periodic follow-up sessions may be scheduled to ensure the child maintains progress and to address any new issues that arise. Models of child and adolescent counseling. 1. Cognitive Behavioral Therapy, CBT, concept. CBT focuses on identifying and changing negative thought patterns and behaviors. It helps children and adolescents develop coping strategies to deal with various challenges. Example: a 14-year-old struggling with anxiety might work with a counselor to identify irrational fears and develop healthier thinking patterns through cognitive restructuring. 2. Play therapy. Concept. Play therapy uses play as a medium for children to express their feelings and experiences. It is particularly effective for younger children who may struggle to articulate their emotions verbally. Example, a 6-year-old child who has experienced trauma might use dolls and action figures to reenact events, helping the counselor understand their emotional state and guiding them towards healing. 3. Family therapy. Concept. Family therapy involves working with the entire family system to address issues that affect the child. It emphasizes improving communication, resolving conflicts, and strengthening family bonds. Example, a family experiencing conflict due to a child's behavioral issues might engage in family therapy sessions to improve understanding and cooperation among family members. 4. Attachment-based therapy. Concept. This model focuses on strengthening the child's attachment to their primary caregivers. It is based on the idea that a secure attachment forms the foundation for healthy emotional development. Example, a child with attachment issues due to early separation from parents might work with a counselor to build trust and secure attachment with their current caregivers. 5. Solution-focused brief therapy, SFBT, concept. SFBT is a short-term approach that focuses on solutions rather than problems. It helps children and adolescents identify and utilize their strengths to achieve specific goals. Example, a teenager struggling with low self-esteem might work with a counselor to identify past successes and strengths, using them to build a more positive self-image. Tools and techniques in child and adolescent counseling. 1. Art therapy. Tool. Art therapy uses creative processes such as drawing, painting, and sculpting to help children express their emotions and experiences. Example, a child who has difficulty talking about their feelings might use drawing to illustrate their emotional state, providing the counselor with insights into their internal world. 2. Behavioral charts and contracts. Tool. These tools are used to encourage positive behaviors and discourage negative ones. Behavioral charts track progress, while contracts outline specific expectations and rewards. Example, a child with ADHD might use a behavioral chart to monitor their progress in completing homework, with rewards for achieving specific targets. 3. Social stories. Tool. Social stories are short narratives that describe social situations and appropriate responses. They are particularly useful for children with autism spectrum disorders. Example, a social story might be created to help a child understand how to make friends at school, detailing steps like greeting others, sharing, and taking turns. 4. Mindfulness and relaxation techniques. Tool. Mindfulness exercises and relaxation techniques help children manage stress and anxiety. These practices can include deep breathing, guided imagery, and progressive muscle relaxation. Example, an adolescent dealing with exam stress might learn mindfulness meditation to stay calm and focused during study sessions and tests. 5. Role-playing. Tool. Role-playing allows children to practice social skills and problem-solving in a safe environment. It helps them develop confidence and prepare for real-life situations. Example, a shy child might engage in role-playing scenarios where they practice initiating conversations with peers, building their social confidence. Case Study 1. Managing Anxiety in Adolescence. Background. Ekta, a 15-year-old girl, has been experiencing severe anxiety, particularly related to school performance and social interactions. Her parents report that she often has panic attacks and avoids social situations. Intervention. Ekta's counselor uses CBT to help her identify and challenge her irrational fears. Through cognitive restructuring, Ekta learns to replace negative thoughts with more balanced ones. Additionally, she practices relaxation techniques to manage her anxiety symptoms. Outcome. Over several months, Ekta's anxiety levels decrease significantly. She becomes more confident in social settings and performs better academically. Case Study 2. Addressing Behavioral Issues in Early Childhood. Background. Raj, a 7-year-old boy, exhibits aggressive behavior both at home and school. His teachers report frequent outbursts and difficulty following instructions. His parents are concerned about his ability to form positive relationships with peers. Intervention. The counselor uses play therapy to help Raj express his frustrations and identify underlying issues. Behavioral charts and positive reinforcement are also implemented to encourage better behavior. Additionally, family therapy sessions help address any dynamics at home contributing to Raj's behavior. Outcome. Over time, Raj's behavior improves. He becomes better at managing his emotions and following instructions. His relationships with peers and family members also show marked improvement. Case Study 3. Supporting a child with autism. Background. Neil, an 8-year-old boy with autism, struggles with social interactions and communication. He often feels overwhelmed in social settings and has difficulty understanding social cues. Intervention. The counselor uses social stories to help Neil understand and navigate social situations. Role-playing exercises allow him to practice social skills in a controlled environment. Additionally, Neil's parents receive guidance on how to support his social development at home. Outcome. Neil shows significant progress in his social skills. He becomes more comfortable in social settings and better understands how to interact with others. His parents report improved communication and fewer meltdowns. Conclusion. Child and adolescent counseling is a dynamic and multifaceted field that requires a deep understanding of developmental psychology, therapeutic techniques, and the unique challenges faced by young individuals. By utilizing various models, stages, and tools, counselors can effectively support children and adolescents in overcoming their difficulties and achieving their full potential. Whether through cognitive behavioral techniques, play therapy, or family interventions, the ultimate goal is to empower young clients to lead healthier, happier lives.
Thank you for your time and I hope you liked the video. Please share, subscribe and like the video. It will give me motivation to create more contents like this and to help you help your loved ones. Stay tuned for more.